Here is a lymph node. I think you could recognize it's a lymph node because you can see a capsule, you can see a subcapsular sinus, you could see subcapsular follicles, and in addition, within the medullary portion of the lymph node, you can see medullary sinuses and medullary cords. There are two things abnormal about this lymph node, however. One of them is the presence of this dark staining within the macrophages or histiocytes of the lymph node. And if you notice, this is not a golden brown pigment like you see with hemosiderin or bile. This is very, very, very intensely black. This is soot. This is anthracotic pigment. This is anthracosis of the lymph node. If you have ever visited a big city anywhere in the world, you probably have some anthracotic pigment in your lymph nodes, especially in the pulmonary thoracic lymph nodes, but maybe elsewhere as well. This is a very, very, very common disorder, and it's not associated with clinical disease. See, all of this stuff is anthracotic pigment within a lymph node. However, there is something on this lymph node that is associated with a disease. In addition to these little soot, carbon, anthracotic particles, you see the capsule of the lymph node here, the subcapsular sinus. And in addition, you see these little nodules, granuloma-like structures. And the reason why I call them granuloma-like structures is because they are granulomas. And in addition to being granulomas, they have kind of a granularity to them, which makes you think they are necrotic. And they are necrotic. If you were to cut through this grossly, you might think it looks like cheese. This is caseous necrosis in granulomas within a lymph node. In addition, you could see cells here, multinucleated giant cells, which is a coalition of histiocytes or macrophages, if you prefer, to form these giant cells. Here's another one. So this is tuberculosis. These are caseating granulomas within a lymph node. And in addition, as an incidental finding, which is present in practically 100% of everybody in the world, you have some anthracotic pigmentation within the macrophages of the lymph node as well. Thank you very much.